Hi, I'm Dr. Jess Anderson, a veterinarian at Cottonwood Animal Hospital, and today I'm going to show you how to draw up and administer an insulin injection to your pet. Things that you'll need are the insulin, an alcohol wipe. You don't have to have a prepackaged one like this. Just isopropyl alcohol or rubbing alcohol on a cotton swab or a piece of tissue paper will work. And an insulin syringe. So with the insulin syringe, it's very important that you have the right syringe to match your insulin. There are two different concentrations of insulin. There are U100 insulins and U40 insulins. Sometimes we use pet-specific insulins in pets, and sometimes we use human insulins. Most pet-specific insulins are U40 insulins, and most human insulins are U100 insulins. And you will over or underdose your pet if you use the improper syringe. So if you look on this syringe, it says U100 insulin only. On this syringe, you can see that it's labeled as U40 insulin. The insulin that we're going to use today is an insulin made specifically for cats called PZI insulin, and it is a U40 insulin. Insulin is generally kept in the fridge once it's been used or opened, and before you administer it, you need to mix that insulin. Insulin itself is a delicate protein suspended in this fluid, and if you shake this bottle, you can break that protein and degrade your insulin. So when you mix the insulin, it's best just to gently invert it or to roll it in between your hands a few times. And this is adequate to mix the insulin. You don't want to shake it violently. So before you give insulin, this is not a critical part, but it is helpful to keep your insulin from becoming contaminated. Take an alcohol swab. This is a prepackaged alcohol swab. You don't have to use a prepackaged alcohol swab. You can use a cotton ball and rubbing alcohol, isopropyl alcohol. Just wipe that rubber stopper. This removes dirt and bacteria from that so that when you insert your needle into the vial of insulin, you're not pushing bacteria and dirt into there. The next step is to take your syringe that matches your type of insulin. Again, this is U40 insulin, so we're using a U40 syringe. Remove the cap from the syringe. Insert the needle into the vial. It's also got a sealed spot on the end. For example, I'm going to draw out 6 units of insulin. So what I'll do is draw down the plunger well past 6 units. In case I get any air in this, and oftentimes you do, and then gently push that insulin back up into the bottle until the top of my plunger stops at the 6-unit line. That's 6 units of insulin. If I were to drop a smaller amount, say 3 units, I'll draw it down to the 3rd line, which is 3 units. And sometimes we administer just 2 units, which is a very small amount of insulin. But today we're going to administer 6 units. I'll draw past the 6 and then gently press it back up to the 6-unit line. When you first learn to administer insulin, it may be difficult for you to tell where you're putting your needle, or difficult to know if you place your needle in the right space. And on a pet that has a lot of fur like Charlotte here, it may be helpful to part the fur so you can see the skin. Let me see if I can get a good view for you, but part the fur so you can see the skin there, and swab that fur with alcohol. That will help slick the fur down and expose that skin so that you know when you place your needle, you're going directly into that skin. I have my insulin syringe ready. And since Charlotte's really not a diabetic cat, I'm just going to administer saline to her today. The needles are very, very small and very sharp, and most pets don't even seem to notice when you puncture their skin with this needle. But what I'm going to do is hold the needle between my thumb and my forefinger. I'm right-handed, so I do that in my right hand. With my left hand, I'm going to tint up a small amount of skin in the scruff area, in the area between the shoulder blades. And I'm going to put the needle into the skin. I'm not going to go straight down. I'm also not going to go 90 degrees. I'm going to go slightly at an angle. Into the skin. I feel it penetrate the skin. And then I'm going to inject and draw it back out. And you can see that didn't bother Charlotte much. And for most cats and dogs, these really fine needles are not very painful and they don't object to it very much.